People with severe mental health issues often find it difficult to get immediate care in an emergency situation. That's the case nationwide and here in Minnesota as well. Rural Minnesota mental health centers are especially feeling a crunch from lack of staff. Hannah Tran tells us more.
Hospital beds across the state are scarce in psychiatric units. It's difficult moving psychiatric patients along in emergency rooms.
So they send them to the hospital, any hospital that has a bed open. They try the nearest one first and then move on out. Southern Minnesota, North Dakota, South Dakota.
A shortage in mental health staff is seen nationwide. It's especially true for northern rural areas in Minnesota. Inpatient or those seeking immediate care from serious mental issues are affected the most.
Are enough of a danger to themselves that they need to be in the hospital. They often are shipped all the way across the state and to find a hospital that actually has room for them.
There's 3 psychiatrists staffed here at Brainerd's Essentia Health Hospital. Professionals here consider themselves fortunate, but they still believe that the population is underserved.
Our hospital often has more than half of our beds filled with people from, 3-4 hours away, that then if local people come in, they can't get in here because we don't have space for them because we're filled up with other folks. And so that
It's not only beds, but technologies and programs too. Patients with specific illnesses like eating disorders have to cross city and state boundaries for support.
there are things like neuropsychiatric testing, which is something that's very helpful for us to kind of sort out different type of diagnoses. There's nowhere here that we can get those. I mean, we have to send people to St. Cloud or send people to Duluth or down to the Twin Cities for those.
Primary care practitioners often pick up the load too, which has caused a cultural shift in their practice.
They're not feeling real comfortable in dealing with psychiatric meds, and this is pushing the boundaries, really causing us to work very closely with primary docs because they're getting patients they've never had to deal with before.
Although the shortage is apparent, changes are still being made to adapt. Hannah Tran, Lakeland News.
There are areas within the mental health sector that are especially feeling a shortage. Local experts see an even greater need in psychiatry for adolescents and children.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.